Commissioners, and welcome to this meeting of the Health Policy Commission's Administration and Finance Committee. I'm Executive Director David Seltz, joined here today by Chair DeVoe, Commissioner Marty Cohen, Commissioner Ron Mastrogiovanni, Commissioner Patty Haupt, and Commissioner Martha Kwasnick, as well as a number of members of the HPC staff. We're meeting today to review the HPC's proposed budget for fiscal year 2025, as well as review the fiscal year 2024 budget performance. Thank you for being with us today as we review this budget in preparation for the HPC's board meeting this coming Thursday at noon, where the full board will be reviewing the HPC's 2025 budget for review and a potential vote. So commissioners and members of this committee, you have all served on this committee for many years and know have had this experience before. And so what we'll do today and what I plan to do is really just first review our performance in the last fiscal year. So that will be the fiscal year 2024, which ended on June 30th. And then move to a review of the spending plan for the next fiscal year and what the appropriation was from the legislature and what that will mean for our budget moving forward. And really have an opportunity for a conversation with all of you and be able to hopefully answer all of your questions. We do not have a vote planned for this committee. A number of years ago, we really shifted the committees to just really be an opportunity for discussion of commissioners, but we will ask at the board meeting that members of this committee report out to the full board this conversation and hope that the members of this committee will be able to reflect the conversation and discussion that we have here today, as this will be really an opportunity for a more in-depth conversation than we'll have at the full board meeting. So with that is just really kind of an overview of the meeting. Chair DeVoe, I just wonder if you have any opening comments or questions before I kind of dive into the content of today's meeting.
Thanks so much. I mean, I will just mention that given that there are some additional responsibilities being considered for the HPC now by the legislature, that I just want to clarify that this is the operating budget that's proposed for our responsibilities as they exist now. If there was any change to those responsibilities, the board and of course this committee would have another opportunity to talk with the leadership team about what that means for us. So which I think David made clear in the intro, we're looking at our operating budget for our current scope and depth of responsibilities.
Absolutely. Thank you, Chair DeVoe. And as we talk about the next fiscal year spending plan, I think that will come into stark relief as we talk about our appropriation and our plans for next year and how those plans may change and may change significantly. So let's first go backwards in time and talk about what happened in the past fiscal year, so fiscal year 2024. So first, just as a reminder about how the budget process works. So each year, the HPC is funded through an appropriation in the state budget through a line item 1450-1200. This line item amount is set by the House, Senate, and administration, and ultimately agreed upon by those three branches through the annual state budget process. Our line item, though, is different than other line items in the state budget in so much as that our line item is what the budget process, or budget people call a fully assessed account. And so what that means is that whatever amount that is set in the budget, we assess to a number of industry entities. And so for the HPC and for CHIA, that means that our amounts set in the budget are assessed to hospitals, acute care hospitals, ambulatory surgery centers at 50%, and health plans at 50%. So each year, the HPC collects from those entities the full amount of the appropriation from those entities and basically then deposits those amounts back into the state's general fund. The end result is that the state budget, the state general fund is essentially held harmless for the HPC's budget and is kind of a net zero impact to the state budget. For the last year, the fiscal year 2024, the legislature appropriated, as you can see here on the final bullet, 11.4 million. And that aligned with our kind of maintenance request. And maintenance request is another one of these budgetary terms, which essentially means what is the amount necessary to continue to maintain the kind of same level of operations as the previous fiscal year, and to maintain kind of the core ability to meet the statutory obligations of the agency. On the next slide, we'll share a little bit about how the year went. So we'll start the year with, again, that appropriation of $11.4 million. In addition to the 11.4 million, the legislature and the administration also approved a $370,000 prior appropriation continued, or what we call a PAC. And so what this was a portion of our surplus from the previous fiscal year. So now going back to fiscal year 2023, where the HPC had a surplus in that year. And what the legislature and administration approved was that the HPC could move a portion of that funding forward into fiscal year 2024 to be able to continue to expend down on those funds to the amount of $370,000. That was approved primarily because the HPC had received an earmark, two earmarks a number of fiscal years ago for a couple of grant programs. And those grant programs took a number of fiscal years to continue to operate and to spend down on those funds. These were the Beside and C4SEN grant programs. And so the legislature and the administration basically allowed the HPC to kind of continue to move some of that funding forward across the fiscal years. For last year, what that means is that the HPC had an amount of 11.8 million available to expend down in that fiscal year. Our projected spending, though, for the year was 11.2. And so that leaves us with an unexpended balance of around $600,000 for the fiscal year 2024. You'll see here that both of these are estimated. That is still because there is an accounts payable period, essentially a time, even after the close of the fiscal year, where we're still reconciling some bills. There is an opportunity to continue to kind of process bills. So this is our best guess right now, but these numbers can change, I think, until, Teresa, you may correct me if I'm wrong, but I think the end of September is the end of the accounts payable period. But these will be pretty close, and I think a good estimate of where we'll end the fiscal year with this estimated 600,000 surplus. In the next couple of slides, I'll share a little bit about where this surplus and how we expended, where our expenditures were in the fiscal year, just to give you a sense of where the spending broke down. And this is our first kind of cut of that. So this is just spending by category in last fiscal year. I think the main takeaway from this is that the agency is really a people agency. Nearly 70% of the budget is for payroll and payroll associated expenses. That's the large dark blue section of the expenditures you see here. The next biggest category for our expenditures is consultants and contractors. That you can see in the lighter blue portion of the pie here at 12% of our expenditures last year at 1.4 million. And that accounted for about 12% of our expenditures last year. And then the other portions of the pie, general admin, IT expenses, rent, and utilities, account for about 13% of our expenditures. And those numbers are relatively stable from year to year. I would say pretty stable from year to year. And so really the areas where we do see some changes from year to year is really in the two largest sections, payroll, where there can be some fluctuations from year to year based on changes in staff turnover or changes in kind of hiring, cost of living adjustments. All of those can have impacts on that dark blue portion. And I think more importantly, actually, is in the consultants and contractors portion of the pie, where this really is our area where we have contract with a wide range of experts to help support our market oversight and pharmaceutical reviews, and where it really is quite unpredictable in any given fiscal year what contractors will need at what timing and in what amounts. And so this is an area where we just tend to see some fluctuation from year to year. On the next slide is just showing again that amount that we see. We had again that 11.8 million of available funds and expended 11.2. And the text here really just reflects what I was just saying, that where we see the under budget spending, we do find that it really is in that consultant and contracting space, and the kind of dynamic nature of our market oversight tends to be the major driver of this. I will also say and give a lot of credit to our Chief Fiscal Officer, to the Deputy Executive Director, Colleen Elstemeyer, and our senior leadership management team for really emphasizing strong fiscal management. Teresa, as many of you know, is relatively new to the CFO position, and as she came in, I think really did a strong review of our fiscal processes and found opportunities for savings and for discounts. And we've really taken advantage of those. There's opportunities for kind of prompt payment discounts that the Commonwealth has negotiated. We've maximized those, I think, extremely well. And I think we, generally just really take our responsibilities of being, good stewards of these dollars seriously and carefully. And so while we do see a surplus here, I think we see that in some ways of that we're doing our job in some cases and doing it well. And that surplus is just about 5% of the total available. So on the next slide, you can see we did spend 95% of our total available spending. So it's not that we are spending close to our total available budget here. And so this breaks that down by some of those important categories. So this is kind of the percentage of the total available total available, and then the percentage of it that was expended by these different categories. So in payroll and taxes, you can see that we expended 98.5% of the total available that we had budgeted in that category. So really close management of our budget in that area. And general admin, and just to note, these bars are not sized to the dollar amounts. So the payroll and taxes, that's 8 million, and the general admin is 400,000. So it's very different proportions, based on the dollar amounts of these bars. In general admin, you can see that we were under about 100,000 from what we had budgeted. One thing of note there was we had set aside some funding for some office renovations that we were going to do in fiscal 24. The building management let us know that they are contemplating some electrical rewiring in the building. And so we have decided to postpone some of those office renovations until the management company does that electrical rewiring. So that will be moved into the next fiscal year. And so that created a little bit of savings in this particular year. I think more importantly, when you go down to the fourth category, which is consultants and contractors, you can see here this is really the area where we did not spend to our total estimated amount. And again, an area where we budget every year with an understanding that we may not that we may get a drug referred to us from Mass Health for a value assessment, that we may get, one or two cost and market impact reviews, that we may get, a whole host of transactions. And as I said, kind of what contractors, what consultants, what experts will need in any given fiscal year is really hard to predict, but we want to have that flexibility to be able to react and to move quickly and flexibly. So, I do think this is an area that just by the nature of our work, that we're always probably going to have a little bit of, some uncertainty, and probably an area where we'll, always want to probably have a little bit of a cushion because of just the uncertainty. And this year, as we know, and as we talk about next year, and this current fiscal year that we're already in, there's just a lot of uncertainty in this area. And I think it behooves us to kind of continue to make sure that we have those rosters of experts ready to go at any given moment. I think this is probably a good place to pause on last year's fiscal year, and open it up to some questions about how last year's fiscal year went in terms of some of these categories.
David, just a question on the revenue side. Were you successful in recouping funds from all of the entities? And I'm particularly concerned, given that we have 9 hospitals in the Commonwealth that are in bankruptcy, what that may mean for revenue in the future.
Yeah, I'll actually ask Teresa to weigh in on our FY24 assessment collection. I do believe it went well, as it always has, and I do believe that the steward hospitals in last year's assessment collection did pay their assessed amounts. But Teresa, please come off mute and share anything on that amount.
Of course, yes. Thank you, David. So thank you for the great question. And as of right now, we received 99.98% for FY24 annual assessment. The reason why we are missing 0.02% is because they are some of them are consolidation, and then some of them are out of the state. So this really the tough one that we may not be able to receive that 0.02%.
I think to the second half of your question, Marty, kind of moving towards the future, the way that these assessments are calculated is based on a proportion of the revenue of hospitals. And so, to the extent, and I'll kind of use a hypothetical just for this sake, to the extent that there would happen to be 2 less hospitals in the next assessment calculation, that amount will just be proportionally divvied up among the other hospitals.
Okay.
And the way kind of just the funds flow work here is that it's not necessarily that the HPC carries the risk on the revenue. It's more that actually the Commonwealth does. We are collecting that assessment and depositing it back into the general fund.
Got it. Thank you.
Ron.
Given the size of the organization, the IT expenses are low. Is that because we have access to the state system?
Yes. So we do have to pay the state for the IT services that they provide. So that's largely what those IT expenses are, is basically they have a way of calculating to state agencies, how much, in-kind services essentially that they're providing to state agencies. And so that is kind of an amount that we pay into EOTTS. I'm seeing head nods from Teresa. And then there are some, internal IT expenses that we have. But I think being able to avail ourselves of the state infrastructure has really helped us on that front.
Yeah. Thank you.
Yep. Seeing no more questions at the moment, I'm going to keep moving us forward. So the next slide was actually about that assessment amount in the last fiscal year. So just a little bit of a reminder about how this complicated assessment actually works. So this was for the last fiscal year. These were the bills that Teresa said that we had collected 99.8% of. But we start with what was appropriated in the budget. We additionally then calculate the fringe benefits. So this is the benefits assessed based on our payroll. So health and pension benefits, essentially. That gets us to kind of a gross assessment amount. And then we credit the assessees whatever surplus we had in the previous fiscal year. And so that is netted off of the assessment amount. So and then that leaves us with kind of a net assessment amount. So last fiscal year, as Teresa said, what were we actually billing these hospitals, health plans, and ambulatory surgery centers is the 13.9. I think the important thing here just to note is that when the HPC does have a surplus, it is not the Commonwealth that benefits from that. It is credited back to the assessees, and they then pay a lower amount in the next fiscal year. So that's really the important point of this slide. All right, next slide. And then this is just a snapshot of our headcount of our FTEs. And so I'll turn it over to Hannah Klumak, our Chief of Staff, to walk us through kind of a snapshot of where we are with our staff here at the end of that fiscal year. So this is as of July 1st.
That's right. Thank you, David. So I know everyone's familiar with this slide. We just we like to keep it updated. So I'll give you just a brief overview of our current status with our employees. So as you'll see from the slide, we've kept in kind of our range, our sweet spot of 60 to 65 for the last 8 years. We do have plans to add a couple of new positions for FY25 for the upcoming fiscal year. But as just kind of a recap for FY24, we hired 6 new people in FY24. 2 of those positions were backfills for from the previous fiscal year, people who had left and they were similar positions, and then 4 new positions. So we're at 65.5, which is right in our kind of average area. So of the 6 new positions that we hired, 1 of those was on our Office of Patient Protection team. 4 of those were in the Market Oversight and Transparency Department, and then 1 was an addition for the Office of the Chief of Staff. With FY25 hiring, we are actively hiring. We have a few open positions currently. We have recently extended an offer to a new member of the Research and Cost Trends team, so they'll be joining us a little bit later this summer. And then we have another couple of positions that we're looking to fill on our Market Oversight and Transparency in the Market Oversight and Transparency Department. So we'll expect to see a couple of increases in FY25. And then one other opportunity that we like to pitch here, and we like to give kind of the update when we do our hiring stats, is talking about our summer fellowship program. So this summer, we are so thrilled. We have 7 great candidates. I know that some of you have already met with our summer fellows, and some are scheduled maybe later this summer. We had over 200 applicants this summer for our summer fellowship program. Those applicants came from 75 different universities in 21 states, plus the District of Columbia. So we hired 7 of those candidates, and they are all currently pursuing graduate or doctoral degrees. So those are in health policy, public health, law, medicine. So they're all kind of pursuing advanced degrees. We have the breakdown for our 7 is we have 1 supporting the Office of the General Counsel, 1 in our Market Oversight and Transparency Department, 1 supporting the Healthcare Transformation and Innovation Department, 2 are supporting the Research and Cost Trends team, and 2 are in the Office of the Chief of Staff. So that's kind of our update.
Great to hear about the interest in our fellowship program, Hannah. As you're talking about the staff and hiring, any other new challenges that we're seeing in terms of either recruiting or retaining best talent? Or do we continue to see that we're getting, applicants as we have in the past for the positions, and that recruitment has not changed significantly?
Yeah, it's a great question. I think, it's always, I think one challenge that we've faced, I mean, not necessarily a new challenge, but from the beginning, is that some of the roles that we have opened up and some of the new positions are very specialized. And so we're looking for a particular skill set. That said, we're fairly lucky. I think regularly when we open positions, we get a lot of interest. The research and they're the analyst on research and cost trends, which we just were able to hire someone for. I think we had, I'm looking at Susie, but I think it was over 100 applicants for that position. So we do see a lot of interest. And I think the fact that our agency is relatively small, when we do open positions, there are a lot of people who I think have been waiting to apply, and we're also lucky, and with the summer fellowship program, I think we get a great word of mouth references from either past fellows or people who have no past fellows.
Thank you. That's great.
If I may just add a little bit of color commentary on this slide, and just to reflect, as you can see on this slide, going back all the way to 2016, really kind of, 62 employees all the way to today, 65 employees. The work of the agency has expanded in this time period. The complexity of our healthcare system has changed dramatically in these 8 years. And I think the output of the HPC, the quality of our work has only improved. The impact of our work has only improved. And that really is a reflection of our ability to retain really incredibly talented staff, and the ability for us to continue to operate at such a high level during this time period with essentially the same number of staff has only been possible because that we've been able to have the longevity of really, really talented people who are so committed to this organization that they continue to work at an extraordinary pace and an extraordinary amount of time and energy. We have a very, very lean organization for what we do. And I say all of this because I think as we think about the future, and if we think about additional responsibilities, I do think we will need to think about the fact that we are already doing much more than I think than that these numbers reflect. I think we are already punching way above our weight in terms of the number of people that we have. And so if there is an opportunity for thinking about how we're going to move forward into the future with additional responsibilities, I think I see this as already starting from a very kind of, I don't want to say stretched thin, but we are really, this is a really, really lean, mean agency for what we do and for the output we do and the impact that we have. Patty?
Yeah, I just wanted to echo, I mean, that's a concern that I've had for a while, making sure that there is adequate amount of staff, because in the relatively short period of time I've been with the HPC, I've just seen your responsibilities grow and grow and grow. And you can only push that so far.
Yeah.
In terms of production and everything else. So I guess that my question would be, and maybe to Hannah as well, is are people taking their paid time off? Including our executive director, and making sure that they're having that type of balance in work and life, because I think we thought maybe after the pandemic we could exhale a little bit, and clearly we're seeing that other challenges have come our way and will continue to come our way. So you can't stretch a thing, an organization, beyond its capabilities without paying a price for it.
Yeah. I don't know, Deputy Executive Director Colleen Elsemeyer, if you want to share your thoughts on this. I know you are championing, our efforts to try to think about the future here. If you have additional thoughts.
Sure, I do have additional thoughts. I'll just answer. I know you asked that to Hannah, but I'll answer what Hannah would say was that yes, absolutely, people do use their PTO,
Okay.
and we have actually probably the most generous leave policies in all of state government, especially when it comes to parental leave. And we have a lot of women and a lot of people who are starting their families in the agency. And this has been a huge part of our ability to retain staff, is to have a huge family focus and people being able to work virtually, or even in the days when they're required to be in the office, stay home if they need to stay home, like I am right now with a sick kid. So I think that's been a huge part of what, as leadership, everyone on this call been pushing so hard for the past few years, and we've really seen the fruits of those efforts. The other thing is we've had over the course of the years, yes, our responsibilities have expanded, no doubt, right? But because we've had such a high retention rate, we've gotten so much better at doing things really much quicker. And I know that's not like the easiest answer, but like a CMIR that would have taken 20 of us 7 months takes, like, Kate Mills will train them in the most rigorous training program you've ever seen and get them up on board and doing this so quickly and so fast. It's remarkable to see, and to work with these people who are now such leaders, not only in the state, but in the nation, and training their own people and bringing up this new generation. So it's like, it's kind of, the efficiency is also really, really high, and obviously something we're really proud of. But yes, we are poised to expand. We're right at that precipice. I'm really excited about it. We have these 2 new healthcare bills coming out of the House and Senate. We're really hopeful that it's really clear from the legislature about what our new responsibilities will be. We'll get a roadmap. We'll be able to build like HPC 2.0 off of that. However, if the bills don't pass, we've been having conversations with the chair and the executive director about saying, what can we do? What can we take from inspiration from the legislature that they didn't necessarily pass, or the governor didn't sign, that we can do? Something like health planning, something proactive that we can take on ourselves, changes to our market oversight regulations, things like that. Like, what can we do now? And so we will be trying to, looking at Commissioner Kwasnick, thinking about expanding our budget in the next few years, regardless of what happens on Beacon Hill. So that's what we've been thinking about for the future. Are we still in the FY24 slides? Sorry. Yes.
We're about to move on.
Okay. Any other questions on that?
No, that was great. Thank you so much. All right, let's move on to the next fiscal year. Spoiler, it's not that exciting. So moving on to the fiscal 2025 budget. So through the budget process, Governor Healy, the House of Representatives, and the Senate all have approved their budget proposals and have funded the HPC at the same amount, 12.028. So while today and this week they have not yet approved a final budget, We do want to move forward with a vote later this week with our spending plan, with the assumption that the final budget will include this 12.028 amount. That is not a certainty. If for some reason they elect to include a different amount, we will obviously be back before this committee and this board for further discussion. But when the three branches have the same number, that typically is the number that's in the final budget. So where did the 12.8 come from? As I mentioned earlier, so for FY24, the total available amount was 11.8. And so the 12.028 was our maintenance request. So we were instructed, we followed the instructions from the administration and from the legislature, who had instructed agencies to again submit a budget that would be kind of a maintenance budget request. So that was our 12.028 amount. It represents a 1.86% increase from the FY24, what we had available to us in FY24. So 1.8 from that 11.8. But if you want to think about it in a different way from what we spent last year, so we expected to spend 11.2 last year. So that's about a 5% increase from what we actually spent. So depending on which way you look at it, either kind of a 2% increase or a 5% increase. Either way, a pretty modest increase and very much in line with the overall budget. And I should say this is, a year of where there was, I think, overall a very tight fiscal management of the budget. So next slide. What is assumed with this $12 million budget? So this will allow us to continue to fund the agency and the staff on a move forward basis with the necessary kind of inflationary and annualized costs from the current fiscal year. So annualized costs of staff and salary increases from last fiscal year, annualized cost of our contracts and rent, and our kind of core programs and obligations. We do also know that we have some core responsibilities that are unique to this current fiscal year. So we have the evaluation of the MGV Performance Improvement Plan, and we do expect to be beginning work on the 5-year retrospective of the Beth Israel Lahey merger, which were kind of included in our assumptions as there are kind of known core responsibilities this year. And we do obviously include within this some assumptions of our kind of ongoing reviews. There's a big caveat here, which is kind of the indented bullet point. In the preparation for this budget request, this predated much of the news around Steward Healthcare and the changes and the filing of the bankruptcy and those bankruptcy proceedings. We today still do not know what that process will result in and what exactly the role of the HPC will be in potentially reviewing one or more hospital transfers of ownership as material change notices, potentially the transfer of ownership of the physician network, all of which we may know more by the end of this week. We may know more by the end of this month. We may know more in the weeks to come. And I would say all of which leaves a huge unknown in terms of what the scope and timing of our potential review and work will be. I think in addition to just what the scope and scale of our review will be, there is also our continued work in collaboration with the administration, where we have provided and have offered, continued data and analytics support for the administration as they have thought about planning for the future. There may be continued transitions of services. To say it just bluntly, there's a huge unknown here, and how that will impact the HPC was not included in this budget request. And I think more so than what I would typically call the unknowns of our kind of market reviews, this is a much more significant and unprecedented unknown. The other obviously significant unknown that was not included in this budget request is the pending legislation and what may come of that, and what additional responsibilities may be included within that, and the impacts of those. So as Chair DeVoe mentioned at really the top of the meeting, these are two areas where it may be that we may need to engage you as this committee, the board, our colleagues at Administration and Finance, our colleagues at the Ways and Means Committee in this budget year, with conversations around opportunities for, if necessary, supplemental funding to be able to meet these obligations. I don't know that yet as I sit here today, because obviously these are huge and significant unknowns, but I want to be transparent about that with you all today. And as these become more knowns, we want to be in very close communication, and be able to work together to try to have a plan around how we'll be able to manage through this. Marty.
Yeah, David, I agree with you. I think there's going to be a lot on our plate that we don't even know. And just wondering, this may be greedy, but given the amount of money that you didn't spend in the last fiscal year, is there any way that could be used as a contingency for as these new items emerge over the next year?
Yes. So that's one opportunity that we're exploring with our colleagues at Administration and Finance. As I mentioned before, there is that opportunity for a prior appropriation continued, which would allow some of those funds to move into the next fiscal year and be available for spending. That's one opportunity that would then not require having to go back and do a supplemental appropriation later. Again, if the funds are not expended, at some point they become a credit to the assessed entities. So that is an opportunity we are very much exploring. Chair DeVoe, I know you had mentioned this up top. I don't know if you have any other comments you wanted to mention here.
No, thanks. Really appreciate the discussion and the fact that I think we're all acknowledging this is a moment where we need to plan for what we know, but be open to the different possibilities that David was describing. And I'm glad we had the chance to talk that through.
Great. Thank you. So of what we know, what is our plan for the next fiscal year? Next slide. So our plan is to really dedicate the additional funding in areas that are consistent with where those inflation kind of annualized costs tend to occur, which is really our payroll and our consultants and contractors. So here again, you can see the pie chart here of projected expenditures by category. And I think probably the next slide is a more useful look at this, which again kind of shows where we would spread across the increase across these different categories. So the most significant change that we would dedicate the additional funding is in payroll and taxes. This is really the annualized, primarily the annualized cost of the additional staff that Hannah mentioned, as well as annualized salary increases that we provided last year, and an allowance, I think, of as Hannah said, 2 to 3 additional positions. Small increases that we're projecting in general admin, rent and utilities, IT expenses, and then a little bit more we're dedicating to consultants and contractors, expecting more activity in that space. This was even before we knew some of this other stuff. So, really, it's a small increase in our budget, and primarily we're dedicating that small increase into the areas that are our primary areas of expenditure: payroll and consultants and contractors. There's one additional piece in the budget that I do think is worth spending a few minutes chatting with you about. These are a set of outside sections that were included in the governor's proposal, and which were included in the House and Senate proposals, and which we do expect some version of in the final proposal, and that will impact the way we conduct our assessment moving forward. So as I've mentioned before, currently we assess both hospitals, ambulatory surgery centers, and health plans for the HPC's budget. And we use different terms of art when we talk about these different entities, especially the health plans. Sometimes we call them surcharge payers, sometimes we call them health plans or payers. Here, and on this slide, I think I refer to them as surcharge payers or payers. But each year we, do a calculation, and has been our practice, and this has been the practice from CHIA. We actually send physical invoices to these entities and receive checks and deposit those in kind of a Commonwealth bank account. We're not the only agency that does these types of assessments. In fact, there are 6 separate assessments on payers across state government for various health coverage and population health priorities. Agencies, both CHIA and HPC, implement these assessments. So in the governor's proposal in the budget this year, they're proposing to implement a unified assessment across state government for one payer assessment mechanism across all of these agencies that would be administered centrally, and then basically dividing that assessment up and distributing those funds to all of the different agencies and programs that currently rely on these assessments. This has a lot of benefits. I think first and foremost, it is much simpler to have one assessment collection centralized than to have 6 different agencies and programs doing different collections and different assessments and different calculations and collecting amounts from essentially the same set of payers. The proposal also has a number of other benefits as they are changing a little bit of the way that the mechanism will run and the calculation that will be used. Ultimately, it will provide an opportunity for some new financial revenue for the Commonwealth through an ability to collect some federal matching funds, and all the while be able to continue to maintain the status quo funding levels for those agencies that rely on it. I want to really thank and credit and acknowledge Martha Kwasnick, Commissioner Kwasnick, our colleagues at MassHealth and EOHHS who shared this language with us as they were preparing this to get our feedback on it. I think what we found was most important as we thought about this language was having clarity that the amount that is dedicated to the Health Policy Commission, that it is clear that that amount would be available to the HPC without having to have layers of approval by the executive branch. We are an independent agency, and our budget and the independence of our budget is important to have that level of independence. And I was really pleased that we were supported in that position by the executive branch, by these other agencies who understand that it's important to have the right mechanisms in place for that. I think we all know that we work really well together with this administration and with this, Mass Health and EUHHS. There's no question that there is a tight partnership, but one never knows in the future. And to have a future administration potentially having the ability to place roadblocks potentially over a portion of our budget would be concerning to us. So I'm pleased with the way language worked out. We are supportive of this. I'm supportive of this proposal from a staff level, and do think this makes a lot of sense. This doesn't change the way that we do the assessment on the hospitals and the ambulatory surgery centers. This really is just on the proportion for the health plans. It will provide a benefit to us, candidly, in so much as that this will take a kind of an administrative burden off of our plates, of something that we don't have to do moving forward. We will have to continue to kind of work with the administration on the annual calculation of what our needs are and kind of the processing all of this. So there will obviously continue to be that level of work, but just the ability not to have to go down and track down each of these health plans. And as Teresa mentioned, some of whom are out of state, some of whom, have very small amounts that we've been able, had to kind of, track down across the country. There's a real benefit to us here. The last thing I would say on the assessment, which is just kind of an FYI for the future, is both the House and Senate legislative proposals also include provisions that would change our assessment on the provider half of this, and include proposals that would expand beyond hospitals and ambulatory surgery centers to other types of large provider organizations. And so it may mean, if legislation were to pass, that the HPC, along with CHIA, will need to revisit the assessments and how we do the assessment on the provider kind of half of this moving forward. And so that will be something that we'll need to work through with this committee if legislation were to pass. That was a lot. It's complicated. I'll pause just to see if there's any questions about this. Commissioner Kwasnick, did I get any of that so egregiously wrong that you feel you need to correct it on the record?
No, as usual, David, you've represented everything accurately and properly and with great aplomb. So
Great. All right. So the final slide here is just what we're going to be asking the board on Thursday, just so that you all can see. I will not be going through, as you might imagine, all of the detail that I just went through with all of you at the board meeting. We'll really probably focus just on the fiscal year 2025 proposal and the fact that, as we've highlighted here for you today, that there are some significant known unknowns. But really, we'll take the final time here today just to answer any final questions you have or any concerns you have with moving forward the proposal of what we know now, and any questions you may have. Great. Well, hearing none, Chair DeVoe, I think we can close this meeting.
Yeah, really appreciate it, and we'll look forward to the board meeting and the opportunity to get a final vote. Thanks to everybody for your